When it comes to renal ultrasound, our goal question is to determine whether or not hydronephrosis is present. While hydronephrosis isn't present in every patient with a kidney stone, it's there very frequently, and it's our tip-off that their pain, their flank pain, and their symptomology is related to passing a stone. As we said in the course material, we see stones only when they're in the kidney, or when they're in the proximal ureter, or if they're in the distal ureter down near the bladder. But the ureter being a retroperitoneal structure behind the bowel gas, it's very challenging to see stones elsewhere. So we focus in two regions when we're doing renal ultrasound. When we do renal ultrasound, I typically still use the phased array probe, the curvilinear probe. However, you can use the phased array probe if you'd like. And again, it's a probe that's designed to shoot through ribs. And when we're doing renal ultrasound in the emergency department, we're typically using the coronal view, which means that our probe is adjacent to the lateral side of the patient. Most of the time, you can also get images from the sagittal view in patients. However, the more bile gas that's present, the more challenging that becomes. The other thing that we can do to improve our views is have our patients roll into a right lateral decubitus and a left lateral decubitus position so that we can see the kidney and image it from the posterior aspect of the patient as well. So when I perform this exam, I use the curvilinear probe. I approach this the same way as I would the FAST exam, which is using the liver as the acoustic window. Get plenty of gel, and the first thing I do is find the liver and then adjust my depth settings. I realize in the coronal plane I may not see the kidney because I'm directing the beam straight across his body, and knowing that the kidney's in the retroperitoneal space, I aim the kidney posterior, the probe posterior, and the kidney usually comes into view pretty easily. And when I'm imaging the kidney, I'm looking at the superior aspect here, the inferior aspect here. Sometimes it's challenging to see the entire kidney with the curvilinear probe because we get a rib shadow through that, so we have to piecemeal our image together. We want to concentrate our eyes on the pelvis of the kidney. It's the pelvis that typically looks hyperechoic because it's got a lot of fat in the collecting system there. And when there's no stone obstructing the ureter, we typically don't see any fluid accumulation, so there's no hydronephrosis. And you want to fan through the kidney, anterior to posterior, to see if you see any shadowing stones in the kidney as well. Now again, if you're having trouble seeing part of the kidney, you can ask your patient to take a deep breath hold. So if he goes ahead and takes a breath, that drops the diaphragm down, gives us more acoustic window and a better view of the kidney. Now, I view the kidney not only in long axis in these situations, but if I'm worried about a proximal stone on the determination that I have hydronephrosis, I turn in the short axis, and then I also will try to fan from superior to inferior. It's easier to see the collecting system medially here. And we can turn on color Doppler, which will highlight the vessels coming off medially as well. So if I see a dilated tube with fluid, I always verify whether or not that's the collecting system or the vasculature of the kidney by turning on color Doppler. So that's the scan of the right kidney. Again, I don't see any cysts, I don't see any pathologic parenchyma, and the renal pelvis, as expected, appears normal. There's no hydronephrosis here. Moving on over to the left kidney, it becomes a little more challenging to us because that kidney is more superior, more posterior. So I'm going to roll him into a right lateral decubitus position to get a better hand position. And that allows me to scan the kidney from posterior here. So you can see that I do have a rib shadow I have to deal with. Sometimes rotating the probe helps me do that. But here's the superior aspect of the kidney, the inferior aspect of the kidney, and again, I can see that there's no shadowing stones in the kidney parenchyma, and there's no hydronephrosis. I don't see any pathologic cysts or abnormal structures there. Again, even though I'm shooting posterior, I still can rotate my probe into a short axis to look at the kidney in short axis. It's going to look more rounded and attempt to visualize the collecting system coming off medially. And we can again place color Doppler where we can see the vessels due to their flow. So again, I typically image in the long axis to initially evaluate for hydronephrosis, and I turn in the short axis to scrutinize what the medial collecting system looks like. If I move more superior, then I bring the spleen into the image over here on the top or the left of the screen. And again, that's a healthy appearing kidney without hydronephrosis. The last part of the renal exam is to lay him flat on his back, and we want to image the urinary bladder. I start with the probe in the long axis position, right in the suprapubic region. Typically when we're doing ultrasound for this application, we've already collected the patient's urine, so we're disadvantaged by the fact that the bladder has very little urine in it, as is the case today. But this is the long axis of the bladder. I can see the prostate just below that. These are the seminal vesicles here, so I know I'm on the midline of the bladder. And once I'm ever imaging the bladder, whether it's renal ultrasound or a fast exam, I fan in the long axis from side to side so I can see the entire bladder in long axis. Okay. Many times, if there's a large stone, I'll see it entering the posterior aspect of the bladder, and it will look like a calcified structure that's giving us a clean shadow, high attenuation shadow just below the calcification. I'll then turn to the short axis, and I'll image the bladder in short axis, fanning from caudad to cranial. And again, you can see that the prostate is here in the far field, and I don't see any shadowing stones entering the posterior aspect as I slowly fan through. Now when the bladder is more full, sometimes they'd be easier to see. Sometimes you can identify where you should be looking by turning on color Doppler. By doing that, you can identify the urinary jets and the production of the urine, and it gives you a better idea of where to fixate your eyes if we can pick up a jet. It can take up to 5 minutes sometimes to find a jet, sometimes even longer. So if you have an obstructing stone, you'll see the jet on the normal side. You won't see the jet on the obstructing side. And we'll see if we can pull one in real quick. Not seeing the jets. So again, the renal ultrasound is going to look at both kidneys in the long and short axis, and we're going to look at the bladder in the long and short axis.